This training is going to be about the regenerating range, which is this range here. Obviously, a regenerating customer is going to use the basic care in that they will use the cleansers and toners in the basic range. They might use one or two of the day creams, for example, and of course ampules from time to time. But let's concentrate on the specific information about each regenerating product. So first of all, a person is going to cleanse and tone in the morning, and then in the morning they're going to use the regenerating serum, 1 pump, underneath their day cream. They might use one of the moisturizers, or they can use the regenerating day cream or the regenerating intensive day cream. So let's do the regenerating day cream. The regenerating day cream you use when you about 40, 45, and your main concern is to prevent or treat the little wrinkles and lines that are starting. So the regenerating day cream, these in the regenerating range, they're the most premium ingredients that one can find. So there's no sense spared in what we have put into the regenerating range. It is the premium ingredients that you can find to stimulate what we call the juvenile forces in the skin. The youthfulness in the skin really needs to be enlivened and woken up. So when the skin gets a little bit lazier when we get older, the skin cell cycle needs to be stimulated and woken up a little bit, and the ingredients in here really encourage the elastin and the collagen to be working correctly, and in each little cell in the skin it needs to have the youthfulness woken up again, and this is what the ingredients in the regenerating range does. So the regenerating day cream is probably your 40-45, beautiful scent, very fresh but calming scents from a fragrance perspective, and then the ingredients like your red clover and clover honey really stimulate this youthfulness in the skin again. It does tighten the skin. It works obviously to firm and tone the skin. So that's the regenerating day cream. And then the regenerating intensive. So at the age of about 55, the skin starts to lose its density, in that it loses its fullness. And the regenerating intensive day cream is richer in oils than the regenerating day cream, so that you know the difference between the two. And the regenerating day cream intensive comes with a partner. And this is the regenerating oil serum. The regenerating serum is oil-free to use morning and night. The regenerating oil serum intensive is the partner for this day cream. So in the morning, you can cleanse, tone. If you are using your regenerating serum, you can cleanse, tone, serum. And then you put the regenerating day cream in the palm of your hand and a little half a pump of the oil serum. Mix together, and that is your day care, your day preparation. You can be in control of how much of the oil serum you add with the Regen Day Cream Intensive. Sometimes you need a little bit, sometimes you need a little bit more, depends on the environment and the demands of your skin. Only in the daytime. Remember, the oil serum will not be used at nighttime because it has oil in it. And the Dr. Hauschka philosophy is oil-free night care. So this has a partner mixed with one and the other one. Then there is the regenerating eye cream, which obviously is only used in the day, in the daytime. We don't use any creams at nighttime. And the very delicate application of this is important. So it has a pump applicator, and your application technique is important to just pat around the eye area like this, on the upper eyelids as well. I always put a little bit on the frown line there and the rest on the upper lip. Then we have a special neck and décolleté cream. So obviously we have a lot of movement in the neck area here. And the neck and décolleté has got special ingredients in to really support this constant movement in the neck area. How we apply the neck and décolleté cream is important to follow the direction of the lymph. We apply down on the neck. Please don't use the old-fashioned technique where people used to go up and think that was good. We want to go down with the lymph treatment towards the clavicle bone. And if you use it around the bust or on the décolleté, you apply it up. So the direction is the clavicle, down on the neck area, and then up on this area here. So we're always directing the lymph to the clavicle where the lymph nodes are here. Neck and décolleté cream, you can use day and night. Not just in the day like the Regen Day Cream and the Regen Day Cream Intensive with the oil. Neck and décolleté you can use day and night. Then we have the Regen Day Cream Complexion. So this is specifically a tinted day cream for mature skin. Personally, I use the Tinted Day Cream. You might prefer the Regen Day Cream Complexion. It has a slightly lighter color to the Tinted Day Cream, but it is the BB cream for mature skin. It has a lovely tint, and also on the tube here it actually does have a little spot color there, so you can have a general idea of the color of the Regen Day Cream Complexion. You can use it on its own, or you can use it on top of the day cream that you use. Then we have special treatments, the intensive treatment for mature skin, regenerating intensive treatment, specialized care for mature skin, and we have an intensive treatment for menopausal skin. And you will know that when you're in menopause, there are special changes that happen on the inside of the body, as well as on the outside. Suddenly there can be some sunspots popping up, or the elasticity or the oiliness really changes in the skin. So there are two different treatments here. The Regen Intensive treatment is used 4 times a year, and it is going to replace your facial toner. So when you cleanse in the morning, 5 sprays in the morning and 5 sprays at night time in place of the facial toner. In the daytime, you're going to follow with your day cream, and at night time, spritz and straight to bed kind of thing. 4 times a year. And of course, when you are familiar with the renewing night conditioning ampules, those are also going to be used 4 times a year. So we don't use these at the same time. So 1 month I'm going to use this as a mature customer, and then I'm going to use that for one month. And then the 3rd month, for example, you're going to use the Regen Serum morning and night. So for a mature skin customer, this is your 3-month cycle. You can use the Regen Serum in the morning, cleanse, tone, serum, and a day cream. And then at night time, you can use the cleanser and ampules for a month. Maybe the next month, I'm going to use Regen Serum morning and night. And then for the 3rd month, I'm going to cleanse, Regen Spray, day cream in the day, and at night time, cleanse, spray, and sleep. And you want to rotate that 3-month intensive care treatment, alternating. So 1 month the ampules, 1 month the Regen Serum morning and night, 1 month the intensive care, and then you repeat that 3-month program, and you repeat it for the next 3 months and the next 3 months. So that is the perfect. It's like giving a different impulse each month to the mature skin. So 1 month they're going to use ampules, the next month they'll be on Regen Serum, and the next month the intensive treatment. And it's like a different information each month to really challenge the mature skin when it is becoming a little bit lazy, or the skin cycle is slowing down, the youthful function in the skin is slowing down a little bit. And these 3 different preparations are going to be very supportive of the mature skin as your 3-month program, and then you repeat in the next 3 months, etc. if you're not on the regenerating intensive spray and you are in menopause, then you will choose the intensive treatment for menopausal skin. It just gives the skin a slightly different little bit of information. So when you're going through menopause, there is so much change and adjustment happening on the inside of the body. The same thing is happening in the skin. So it needs the handheld of the skin and the body, and in a slightly different way. You will still use your cleanser, toner and serum, for example. That is, this will remain the same. Cleanse, tone, serum and day cream in the morning. And when you're on the ampules, you will be on cleanse and ampules at nighttime. And then that third month, you will be on cleanser and your intensive menopause spray morning and night, which replaces the toner. Sounds a little bit confusing. Your account manager does have it for you in a printed version, and it is in your cosmetic culture book and your prescription sheets of the suggestions for mature skin, of how they can incorporate all these different messages to the skin and different ingredients and different impulses to the mature skin that does need extra care.